extramural pediatrics impact healthcare, and specifically child healthcare. And I believe, the government should be focused on child healthcare because it's the future. We need to have healthy kids so we can have healthy human beings in the future and being productive, good people. But without healthcare, we have an issue.
Really getting to know families over time, getting to know areas over time, just spending a lot of time in these communities. What that really allows us to do is, obviously it's treat patients and work with families on an individual basis, but it's also creates an ability for us to get to know what are the community needs. What else can we do to help the community have good healthcare infrastructure? What can we do that sets them up for good healthcare? Because that's a huge part of preventive care.
Maybe I can go to the other teams, but when Extra Mile comes, please just let me know and I will ask a permission in my new job, because it's something that I really want to do it, and I'm really excited to every time I know the team is going to come, because you have the opportunity to change the reality of your country.
I truly believe that investing in those needs, it's really gonna impact not only that week, not only that year, but a lifelong experience. And I hope I can have the health and the time to be there always. If they're gonna come twice a year, once a year, I want to be there. I don't want to miss that. And tell others and invite others to join, to be part of the change, be part of the good impact.
What I'm most looking forward to on my next trip back is meeting new people. We've got some returning volunteers who have done other missions, and that is always such a treat. But also meeting these families, meeting their culture, learning about them, and establishing these relationships with them. And then looking forward to going back again. So it's really just the beginning. It is just planting those seeds. That's what I'm most looking forward to.
As we start to look at taking on new projects that are going to make so much more impact, and really, we always want to make an immediate impact while we're in country, but we also simultaneously want to be growing capacity, growing our capacity to serve these families in terms of reaching different patients, but also the consistency with which we can reach them. And really that takes resources. So we are in a position now where we're ready to grow those programs, and we just need the help to do so. So part of that's financial, and whether that's in the form of a one-time donation, or really because of the way our model sets up, we have a lot of folks that have started to give on a recurring basis, and that helps us so much, because as we look at these programs, we start to budget out what we're doing. Having those consistent donors at our back really allows us to do some great work, and it really aligns well with the way we're set up, and we're really set up to commit and repeat.
As a board member, we will continually need help to support our actual missions, to support supplies, medications, lodging. We will also need recruiting for providers, nurses, lay people to come and do the work to serve these people. And that's always a really challenging thing, to get people to leave their job, leave their families. Getting people who want to serve is a great help.
We're thankful for all of our donors. It's amazing whether generosity has blown us away. During the pandemic, even when times were tight, it's been amazing. And so we're thankful for every dollar we're given, whether it's a one-time donation that just is on someone's heart at that time, or whether it's a commitment, somebody's getting excited about what we're doing and they say, hey, I want to continue to give. We're just super, super grateful for that.